Should I get the COVID-19 vaccine? Questions answered for the Black community. This program was made possible by Blue Cross and Blue Shield of Minnesota and is a co-production of Twin Cities PBS and KMOJ. Welcome to the program. My name is Chantel Sings, and this is KMOJ, and this is a special program called Should I Get the COVID-19 Vaccine? Questions Answered for the Black Community. This program was made possible by Blue Cross and Blue Shield of Minnesota and is a co-production of Twin Cities PBS and, of course, here at KMOJ. The purpose of this program is to talk about COVID-19 vaccination in the context of the Black community and to empower audiences to make the medical decisions that are best for themselves, their families, of course, and their communities. And joining us, two amazing figures in our community, Dr. Nathan Chomilo. He's a medical director for the state of Minnesota's Medicaid and Minnesota Care programs and practices as a general pediatrician and hospital internist with Park Nicollet. He is an adjunct assistant professor of pediatrics at the University of Minnesota Medical School and is a co-founder of the organization Minnesota Doctors for Health Equity. His work has been recognized by the City of Minneapolis Department of Civil Rights, which recognized him as a 2019 History Maker at Home recipient. Also joining us, Marcus Owens is a social entrepreneur, systems shifter, and community developer. He believes that expanding economic and educational opportunities and improving health and well-being for all is key to building a healthier and just community. Thank you both, Marcus and Dr. Chomilo, for joining us. How are you?
Doing great. Thanks for having us, Chantel.
Yes.
Yeah, thanks for having us.
For sure. Thank you so much. Very much a much needed conversation around vaccinations. A lot of people have their thoughts about this. It's a very big topic on social media right now. We know that there are two vaccines on the market, Moderna and Pfizer, as of the creation of this program. So we're going to talk a little bit about the communities and what you guys have seen as experts and medical professionals in the industry. First and foremost, Dr. Chomilo, let's start with you. Who should get a COVID-19 vaccine, and can everyone get it?
Well, I'd say I hope eventually everyone gets the COVID-19 vaccine. Right now, the two shots that have been approved for emergency use authorization through the FDA, the Pfizer shot is approved for those 16 and older, and then the Moderna shot is for those 18 and older. And we aren't recommending if you have any kind of like short-term illnesses like flu-like symptoms, if you recently had COVID-19, so generally within the last 3 months. And then we have seen some people have allergic reactions to shots, just like we see allergic reactions to other types of medications. And so if you've had any allergic reaction to a vaccine or a shot before, we're recommending you talk to your doctor about it before getting the shot.
Dr. Chomilo, you mentioned about some age groups. What's that about? Is there a certain age group of which can receive which vaccine?
So under how they were approved, each trial had a certain number of participants down to certain ages. And so that's the different kind of discrepancy in age range. And so in general, most teenagers aren't getting vaccinated at this point. We're really focusing because, we're looking at priority groups based off of healthcare workers, those in long-term care facilities like nursing homes, and then moving into older folks in our communities who are at higher risk. But the shot is approved. The Pfizer shot is approved for 16 up, the Moderna for 18 up, and there are trials going on right now to look at the shot for younger kids. But I think we'll still be a couple months away before those are available widely.
Wow, wasn't aware of that. Thank you for making that known for those who did not know that. Marcus, how can the Black community trust that the COVID-19 vaccines are safe when they were developed so quickly? And also, who is involved in the testing? And then, Dr. Chomilo, I'll get a second opinion from you on that same question.
Yeah, thanks, Chantel, for the question. And first of all, just, community, I am a professional, right? I'm a community member coming to this discussion. So I'm faced with many of these same questions from my family as we're, thinking about when it's time for us to take the vaccine, what are we going to do? And as a family, we decided we're going to take the vaccine. I mean, I think it's important for us to move forward in our lives and help our community and those around us to be healthier and not spread this deadly virus that has really impacted our community. So, from a trust perspective, I had to get there. And many of the discussions I have with folks in community or here, whether it's on social media or just anywhere else, is that, there's this long history of medical research without informed consent, and just overall personal negative experiences with the medical field in our community. And, that warrants a lot of distrust in systems. And, even with this past administration and how quickly they did it and what they've done, throughout this pandemic has, brought a lot of questions up. But, what I did, as an individual and with our family is like, okay, well, who can we trust? We have Black doctors that are in the field, like Dr. Chomilo and Dr. Zeke McKinney, that have a lot of great information and got a lot of great knowledge and have been involved in the process of, how this has been developed and brought to our communities. And so as I listen to them talk about, what's happened, what are the pros and cons, I really took to heart, and trust that their professionalism and their provides me some level of like understanding and trust that, this is the right thing to do. Right. And I think as a community, we have to educate ourselves, and we have to find out who are those experts in our community that, can provide some level of reassurance. Now, nothing is perfect, and we have to figure out where the lines are for ourselves. But, this is one way that we can ensure that our community is safe long term.
Absolutely. You're listening to Should I Get the COVID-19 Vaccine? Questions answered for the Black community. And I'm your host, Chantel Sings. We're talking to Dr. Nathan Chomilo and also Marcus Owens. Dr. Chomilo, the same question for you, but also who's involved in the testing of these vaccines? And what is your trust level as a medical professional in the industry at this time with COVID-19 and the pandemic?
Yeah, I want to thank Marcus for really touching on a lot of kind of similar, steps that I took in kind of making the decision, both for myself, but then as a medical professional, whether this is something I could go out and tell my patients and recommend to them, with confidence. And, I had my own questions, at the beginning of the pandemic about the speed at which, the vaccine was developed, some of the new technology. And so I had to, do a lot of my own research and studying and reading about the science behind it, talking to experts I trust. I also actually go back to medical school with Dr. Zeke McKinney, and so he's a doc in the community I really trust as well. And then some national experts that I know and have followed for some time around vaccine development. And it really came to the similar conclusion that, we don't know everything, and I think it's important to have these honest conversations. But from what we do know, believe that the shot is our best bet. It's safer than risking getting COVID-19. And, some of the things that really reassured me about the speed. It was, one of the reasons we got here faster was just the amount of money and brain power that's been really focused on this one question. We haven't seen that like at any other period of time in our history where we have all these scientists and we have all this money focused on one problem. And we know that money moves things. And so, that's one of the reasons we're able to get here quicker. The technology itself also allows it to get quicker. And then the fact that we're in a pandemic means that the virus is just everywhere. And so to know if a vaccine is safe and effective, you just need people to be exposed to the virus. And in the past, we haven't had outbreaks like this. And so it takes longer to, for people to get exposed and to know. And so I think those things really helped me. In addition to kind of your question about who is involved in the testing. And so the development of the vaccine has been really impacted by Black physicians. And so the Moderna vaccine in particular, Kazmika Corbett is a physician at the National Institutes of Health, who's one of the lead scientists and virologists, is a Black physician, or Black scientist, I should say, who really worked to help pilot and develop and produce that vaccine. And she's, been on the record saying that, this is not at all like Tuskegee. There's been Black physicians involved in every step. There's been participants involved and, made aware of the risks and benefits at every step. And even though representation hasn't been quite what we'd hope, in the Moderna trial, there was about 10%, and the Pfizer trial was about 9% of the participants who were Black, versus, in our country, about 13% of us are Black. it's a lot better actually than historical precedents. And so if you look at clinical trials before, usually it's only about 5% of individuals that are Black. And so you think about all the different treatments and things that we take and rely on medicine for, we've historically been underrepresented, and we actually have better representation than previously seen in these trials. And so the last kind of point I'll say is in one of the other groups that I was really looking at to kind of help make my decision was the National Medical Association. And so the National Medical Association was started by Black physicians when they weren't allowed entry into the American Medical Association. And so they're the largest and longest standing Black physician organization. And they created their own independent panel to look at these reports and data that the FDA receives from the companies, and then ask specific questions about from the companies about the vaccines themselves to come up with their own independent recommendation. And they felt that both the percentage and number of Black people enrolled were sufficient to have confidence in the health outcomes of these clinical trials. And they feel like for our communities, getting the shot is the best opportunity we have to keep us healthy and safe. And so, really looking at different experts, having these conversations, welcoming, the conversation. But, for me and for my patients, I'm really recommending that, we get the shot.
So, Dr. Chomilo, another question to you in regards to people who just don't, we're speaking about trust with the vaccinations and everything. What about the group of people who are apprehensive about taking this vaccination for COVID-19? Is there going to be some type of measures in place if we start to see a lot of more people not willing to take the vaccine? Will there be measures put in place to make sure that the majority of people that we need to take this vaccine in order to get this pandemic under control? Are there going to be measures put in place? There's not going to be an option at some point, basically.
Right, like it'll be mandatory or forced. Yeah. So one, at least where we are right now, the 2 shots that have been approved are approved under this emergency use authorization, which means, they were able to get out there quickly because of the, public health emergency we're in. And under that authorization, you cannot mandate someone to take the shots. And so schools can't mandate it, employers can't mandate it, the government can't mandate it. And so, as long as it's in this emergency use authorization, which I anticipate likely, through this year, there really will be there's not the ability to be mandated to do it. Now, going forward, I do think down the road that we will see, for the public health good and for trying to get back to, the life we enjoyed before COVID, that you'll see some places, some employers will, enforce it. I think down the road, schools, I can imagine countries, if you want to travel places, they'll be requiring it. And so I do see that down the road, but I don't see that in the short term being an issue just because it's not allowed under law.
For sure. And also, so next question, if a person gets the COVID-19 vaccine, can they go back to doing things like seeing extended family, going to church and eating in restaurants, getting back to, like you talked about, that normalcy that we all miss so much? After you've been vaccinated, how soon can we go back to doing the things that we did before the pandemic?
Yeah, I think this speaks to the need for us to approach this with a thought of the impact of our community. Because if you get the shot yourself, you will be protected from the worst complications and from death from COVID-19, but you could still potentially spread it to others. And if they haven't had the shot, then they could get sick and they could suffer complications or even death. And so, we need about 70 to 80% of the people in our community to either have survived COVID or get the shot to have what's called, community immunity, right? And so that's going to take a lot of us, thinking about our health, but also thinking about the health of our communities before we get back to some of the normal things. And I don't know if that's, something that you guys thought about, Marcus, in your guys' conversations about, taking the shot.
Yeah, and this is a really good point here about what's going to happen after I get this shot. And I think, and I've seen this in a couple circles where people are passing around different articles around the fact that someone got the COVID-19 after they got a first shot. And people need to realize in our community is that this is a process. It's not like I get a shot and everything is normal, right? And it's like you're still going to have to take precautions until we get to that community immunity point, right? Mm-hmm. And even within that, there's nuance where it's like the doctor said, there's 2 shots, and you may have been exposed to COVID before your first shot, which means you could get it, right? And you still have another shot that's 3 or 4 weeks later. So like going through the process of like get vaccinated and then taking that time to still kind of use the same precautions you have, like wearing a mask and social distancing, is going to be still a fact in our lives until we get to that point. And then, working through that process. So for us, we're like, okay, get the shot where it's available, and then, still go through those precautions in hopes that by the end of this year or early next year, we're back to the things that we enjoy doing.
Absolutely. We're talking to Dr. Nathan Chomilo and also Marcus Owens about the COVID-19 vaccines in the Black community. We're answering questions specifically for the Black community. Marcus, continuing with you, how does the COVID-19 vaccine work exactly for people who just don't understand it, and that's part of their apprehension with even deciding to take the vaccine?
Yeah, so the things that I know through the research I've done, and again, I'm not a medical professional, right? I'll let Dr. Chomilo talk about that part, but this is for me what was a kind of a turning point. Like, I don't take the flu shot, for instance, and I've had years where I'm like, you know what, I don't get the flu, so I don't take the flu shot. So I don't use that same lens of why I would take this shot. So the Moderna and Pfizer vaccines are really different than me taking the flu shot. And one of the reasons that, I see it as different is that the flu shot injects part of the flu in you, right? But Moderna and these vaccines that we have, it's a way different process, and I'll let the doctor talk about that. But, you take one shot, and it sounds like you have to take that second shot after a couple weeks, which means that it's not like bang, bang. It's like, okay, take it, make sure that you respond to it, and then you get your second dose and make sure you respond to it. And they're constantly looking at how people respond to these different vaccines.
And Dr. Chomilo, just from your medical expertise, can you give me your take on how the vaccine works? And for people who do, like Marcus say, they don't take the flu shot, they've never taken it, how is it different from a flu shot?
Yeah, that's a really great point that Marcus brings up, in that it is different than the flu shot. There is no COVID-19 virus or SARS-CoV-2 virus in the shot itself. And what it really is doing is it has what's called, mRNA, which is messenger RNA, packaged in a way that it kind of teaches some of your cells how to make this protein called the spike protein. And if everyone's seen those pictures of the coronavirus, the spike protein are those kind of like red knobs or crowns all going around that sphere of the virus, right? And so what it does is it teaches your cells how to make this one specific protein. Your body recognizes that protein and then is able to make the defense against it, so that if your body sees coronavirus, it then recognizes that protein on the coronavirus and is able to shut it down before you get sick, right? And so it's I've heard one of the former FDA directors kind of describe it as, it's basically an email that is sending, instructions to your body about how to create this protection and destroy the virus, and then it disappears like a Snapchat, right? So it doesn't linger around, and so it doesn't change your DNA, it doesn't do anything like that. And the shots are really effective, in the studies, 94-95% of people who got the shot were protected completely from getting it, and no one that got the shot died from COVID-19 in any of the trials. And just to compare, the flu shot, as that's science that we're continuing to try to improve, but year to year, we about 60% or so of people who get the flu shot are completely protected from the flu shot, and so it's a really great way to protect against COVID-19. And I think the other thing is that we see COVID-19 a lot more so than we even see during our worst flu season. We see how deadly it is and how much more deadly it is in the flu. And so I think, it really is a lot different. And so I think it's good to make those distinctions.
Thank you both. Great answers and responses to the questions. You're listening to Should I Get the COVID-19 Vaccine? Questions answered for the Black community. We're talking to Dr. Chomilo and Marcus Owens. Dr. Chomilo, what are the short-term and long-term effects of the COVID-19 vaccine? With any vaccine, a lot of times times there are some side effects, but there's not a lot of information, I don't think, about the long and short-term effects of the vaccine itself.
Yeah, well, there's actually more and more information about the short-term effects because, the trials have been going on now for around 8 months. If you look all the way back to the first phases of the trials. And so, the short-term effects we know of are, having some kind of muscle soreness. You might have some pain and redness at the injection site, some fatigue, even some headache. But most people tolerate the first shot really well. In fact, I got my first Pfizer shot 2 weeks ago. I had nothing the first day, woke up the next morning with some soreness in that arm, and then it was gone within 24 hours. And that's a pretty common kind of side effect from the first shot. After the second shot, we are seeing some people have a little bit more like fever, chills, body aches, and fatigue, and feeling just kind of ill, for 12 to 24 hours after the shot. But people recover within a day or two from that as well. When we talk about long-term side effects, for most shots, any long-term side effects we see happen in months. We really don't see long-term side effects where you get the shot, you feel healthy, and then like years down the road, you start to have troubles with your health that's related to the shot. That doesn't happen with how vaccines work with our body. And so we haven't seen any, long-term side effects across the board with these shots at this point. The thing I always like to kind of also throw into the discussion is that we are also still learning about COVID-19, right? And so we all are pretty aware now of the short-term effects of COVID-19, getting sick, cold, cough. Then some people get really sick, end up in the hospital, and then, the worst is people dying. We're still learning about the long-term effects. So if you survive the short-term, effects of COVID-19, what are going to be the long-term impacts on your health? And we're seeing some people who, get COVID-19 and don't get their energy levels back up, start having issues with their hearts. We've had some people, get issues with blood clots and stuff like that. And so I think it's important to kind of know that, while we don't know everything we'd like to about the shots, we also don't know everything we'd like to about COVID-19. And on the whole, the risk of the shot is much lower than the risk of COVID-19, short-term and long-term, known and unknown.
This program was made possible by Blue Cross and Blue Shield of Minnesota and is a co-production of Twin Cities PBS and KMOJ. Should I get the COVID-19 vaccine? Questions answered for the Black community. As we're wrapping up, running out of time. Marcus, can you tell us where, when, and how can we get the COVID-19 vaccine? Is it free? Where can you go for more information?
Yeah, so right now, all Minnesotans will eventually have access to the vaccine. But due to the limited supply, supply chain is a big deal right now. And so to limited supply, not everyone will be able to get the vaccine right now. There are in different groups of folks that should be focused right now, and that's the healthcare workers, frontline workers such as educators, and then just recently populations that are with above 65, right? And so it's really important for our community right now to really focus on our healthcare providers, our educators, and then those that are 65 and older, because we want to make sure that they are protected first and foremost, because they're the ones being impacted the most in our communities, particularly around Hennepin and Ramsey County. The other thing, if you want more information, this will be released by the Minnesota Department of Health, and so you can go to their website at mn.gov/COVID, COVID. And also, there is a Black community hotline that the African American Leadership Forum is partnered with the Phyllis Wheatley Community Center to get all of your questions answered around COVID-19 as it relates to the health, components to it, vaccines, if you're unemployed because of it, if you're losing housing, if you have food insecurity, call this number, 612-254-1145.
Thank you so much for that, Marcus. Dr. Chomilo, as we wrap up, we know that there are some myths out there. There's some misinformation. Not everything that you hear and see is factual. Can you give us just a few myths and facts about the COVID-19 vaccine that you've been seeing in your profession?
Yeah. So we have questions like, if I already had COVID-19, I don't need to get the vaccine. And that's, not true. We know that we think that you've got some protection to that specific kind of strain, but we've already seen that there's new strains coming out, and so people can get reinfected with that. And there's good evidence that the shots help protect you from different strains better than getting the virus itself. There's some concerns about if you have underlying health conditions or immune suppression, things like HIV, or on medications for cancer, things like that, that you shouldn't get vaccinated. And we do know that people in these categories are actually more likely to be negatively impacted by COVID-19, and so whatever you can do to protect yourself, including getting a vaccine. And that's one of the specific questions the National Medical Association asked about, folks with sickle cell and HIV and other things like that, and recommend that they get vaccinated as well. And then I think we talked a little bit about, like the messenger RNA, sounds like DNA, and so there's concerns that it's going to alter your DNA, but that's not what it does. It doesn't ever get to that part of your cells even, and so it doesn't alter it. And then one that I've kind of had a lot of questions and concerns about is going to impact on fertility, whether breastfeeding or pregnant mothers can get it. And there's no evidence that COVID-19 vaccines make you infertile. In fact, there was women that signed up for the clinical trials who were not pregnant at the time, and then they got pregnant while on the trial. And so, there's no evidence that this, that this impacts fertility. And the American College of Obstetrics and Gynecology, recommends that pregnant women who are breastfeeding or trying to get pregnant, talk to their doctors, but that should not be a reason that you don't get the vaccine.
Wow, it's a lot of myths, a lot of facts out there. Thank you so much for clearing that up, Dr. Chomilo. And thank you again to you both, Marcus, for all of your information, all of your expertise on the COVID-19 vaccine, specifically for the Black community. We appreciate your time. We'll definitely have to check back with you as this thing continues and these vaccinations continue to be distributed to see how things turn out moving forward. So thank you so much, Marcus Owens. Thank you, Dr. Nathan Chomilo. We appreciate you.
Thank you.
Yeah, thanks, Chantel.
Absolutely. Should I get the COVID-19 vaccine questions answered for the Black community? This program was made possible by Blue Cross and Blue Shield of Minnesota and is a co-production of Twin Cities PBS and KMOJ. I've been your host. I'm Chantel Sings. Thank you so much for listening. Should I get the COVID-19 vaccine? Questions answered for the Black community. This program was made possible by Blue Cross and Blue Shield of Minnesota and is a co-production of Twin Cities PBS and KMOJ.